So what I'm going to do is just go through exactly what the operation involves,
Yes.
and then tell you about some of the risks, obviously,
Yes.
that are involved too, and then you can ask me any questions that you wish to.
Yes.
So what we brought you in for this evening is for us to undertake TAVI, or transcatheter aortic valve implantation, tomorrow.
Yes.
And we're doing that because you've developed breathlessness over the past year or so, and that's due to a narrowed valve in the heart called the aortic valve. And the operation, we hope, will improve your quality of life, so the breathing difficulties that you've got. And the added benefit also is that we know from the evidence out there that it also extends your life as well. So there's two good reasons for doing the procedure. Now, as with all procedures where all operations, there is an element of risk, which we've discussed before, which I'm going to go over again for the consent. So the most important risk that you need to know about is that there is a risk of not getting through the operation.
Yes, you did tell me that, yes.
And the risk of that happening is about 10%, so a 1 in 10 chance of not getting through the operation. But the better way to look at it is a 90% chance of getting through the operation. There is about a 5% risk that we might need to put in a pacemaker, and that's due to the valve stretching the electrics in the heart so they don't work quite properly, so that we need to put a pacemaker in. And we would do that either directly there and then, or maybe in the days afterwards, but certainly before you go home. Another risk that you need to know about is that there is a small risk of a stroke occurring, and that happens because debris from the valve gets thrown up into the vessel supplying the brain.
Yes.
The risk of that is small, but nonetheless there is a risk, and the risk is around about a 2 to 3%. There is a small risk that we might need to give you some temporary dialysis if the kidneys don't work quite so well after the operation. But in your particular case, I think that risk is really quite small because your kidney function is actually very good at this time. So what can you expect after the operation? This will be done in one of our catheter labs downstairs, and when you come to, we'd hope that you come to in our coronary care unit if there are no complications.
Yes.
But if things don't go quite as smoothly as we'd wish to, then we might recover you to our intensive care unit where you can be looked after just that much more closely. I hope that you can go home in the order of about 5 to 7 days.
Yes.
It may be a little bit longer if there are any problems, but certainly a stay of around about that order is usual. In terms of medications, there's going to be no change to your existing medications. You're on warfarin for your mechanical mitral valve, and so certainly we don't need to add any medications in the long term. We are, however, going to give you a dose of aspirin this evening just to cover the operation itself. Right.
Does the aspirin thin the blood down then? Will the aspirin thin the blood down?
What it does is warfarin is a blood thinning agent.
Yes.
The aspirin, if you like, just stops you clotting, so it doesn't do the same thing as warfarin, but it works in a different sort of way.
Oh, I see.
But we're only going to give you that temporarily whilst we reintroduce your warfarin, so you won't be taking that in the long term.
Oh, I see. That's just because if I have medications, I always make sure there's no aspirin in.
Of course.
Because of that, and that's when you said you were going to give me aspirin, I wondered why.
No, I understand your concern. In the long term, yes, when you give aspirin and warfarin, there is a risk that it increases bleeding. But we're only doing that temporarily here, so that you don't have to worry about for the long term. Now, are there any questions that you want to ask me about the operation or what's going to happen afterwards, or why we're doing it?
I don't think so. I don't think I want to know. Thank you very much.
Okay, good. So if you don't mind now, I'm going to ask you to sign your consent form. The nurses will be giving you that dose of aspirin shortly, and then we'll ask you not to eat anything from midnight tonight.
No.
And you're first on the list tomorrow, so we'd hope to roll you down sometime just after 8 o'clock.
Yes.
So if anyone sort of rolls up with tea and toast in the morning,
I know that.
Politely decline, because you shouldn't be having anything.
No, I won't do that.
Okay, but there'll be something for you after the operation when you come down, you're able to take food.
Thank you very much.
Okay.
I'm very grateful. Well, I hope I can do more things in the house that I can't. I mean, it just happens over a time, and all of a sudden you think, well, why can't I do that now? And I used to, and I'm hoping I'll be able to do it again. You know, to do things that I used to do that I can't do now, and that will be nice. And even going shopping and being able to walk further than I can walk now. But it will be nice to be able to pick the little ones up more often, because I'm finding that rather difficult. But I mean, the others are all grown up. It's just the great-grandchildren. You know, to be able to play with them.